trauma. That's all I got.
That's all you've got?
That's all I got. I think Gen Z has become very well accepting of mental health. And with that, I think trauma has become a big word used often.
Used often, yes. I would probably agree. And along with a lot of mental health lingo, diagnostic lingo and so forth. But trauma specifically, you're saying is used frequently. Like when you say that, do you mean almost like in a good way or in an almost...
It's not always trauma.
Huh?
It's not always trauma. It's just sort of life.
Yeah. I know that's something that we're going to be talking about coming up. And yet for today, what we were talking about, because I was sort of blown away when a client, and I feel like I try to stay up on things, keep a pulse on what's happening out there for different sort of age groups and so forth, because as individuals have different experiences, I want to try to make certain that I'm staying up on what those might be. So as I like to tell you, I try to stay jiggy with it. Anyway, but I was a little blown away when a client, which I have permission to share this, when a client shared that like trauma dumping and trauma trumping is like really common amongst your age group. So tell me a little bit, like, let's pull all this apart and like dig deep into this trauma dumping, trauma trumping, and then I'm going to even throw in there some trauma clumping because it's a whole lot.
Okay.
So what's going on? What are they doing? They're just coming and just like, blah, it's all there?
Yeah. I think it's part of oversharing.
Oversharing?
Yeah. Like that, but like on an extreme, Like there's the oversharing, giving a little too much detail, but then there's the, let me tell you every traumatic aspect of my life.
And when you say, let me tell you every traumatic aspect of my life, it almost sounds like there's a lot going on for the person.
Maybe.
And some of it might be trauma, some of it might not. We are not going to get into that in this episode. But it sounds like maybe the person is overwhelmed.
No.
You don't know? They just come and they just like put it all out there for everyone.
They can usually find a way to squeeze into a conversation.
Oh, really? So squeeze it into a conversation.
Stop overanalyzing what I'm saying.
Well, I'm just trying to understand it more.
Repeating what I'm saying is not understanding it more.
Okay. So when you say they're squeezing it into conversations, are these like in person? Are they group chats?
I'm not in group chats. I don't like group chats. But I'm sure. Yeah, it's online. People just like to post their thoughts and opinions.
Okay. So it's just really everywhere. People are just sort of that emotional vomiting.
The no filter.
No filter.
Part of me wants to say no social awareness with that. I don't know.
I've also heard this phrase that I've been pondering a bit more because I'm not certain I quite agree with maybe how it's being used along with other words such as trauma. Again, outside of context of this episode, but I hear that some of them are like saying some of these things to be them authentic self, like this raw, unfiltered.
That's where I'm like the social awareness, sweetheart.
Okay, tell me more on that.
I think there's a level of raw, authentic self that just simply is not raw, authentic. Like, perception of who they are,
Okay.
Like, there's who you are.
And how they maybe want people to perceive them to be.
I think when you start being like, oh, I'm going to tell you all my trauma because I'm going to be my raw, authentic self, you're basically telling people you want them to see you as your traumas. I think it's a certain level of I want to be praised for what I've been through and how I'm still here.
Like they need to be validated.
Not even validated.
Like that's their identity. Their identity is through their
and so I don't think that's
tough
raw and
experiences.
authentic. I don't know. I think you're being raw and authentic is like, let me show you my personality. Let me tell you, like, I think raw and authentic is more personality wise and how you carry yourself, and then everything else is just, I don't know.
That brings up some interesting points, because I do think when individuals have experienced traumatic events, and by traumatic events, I tend to use it and I know there's multiple definitions, but clinically I'm typically using it that either they believed their life was in danger or somebody else's life, or there was a threat to physical integrity, right? Like they thought somebody was going to die.
I've taken enough classes with you. I know.
You know this. Okay. So that's where, and again, there's other definitions about overwhelming inabilities to cope with whatever experience it is and so forth. But when individuals have those trauma experiences, and they have not maybe healed through that, and by healing, it doesn't mean like get over it, but maybe made some sense out of it, understood themselves and how it's impacted them, understand how it is a part of them, but not who they are. And I think that's what sort of stood out to me when you were saying it, right? That trauma is something that happens to people, but it does not have to define them. But what I'm hearing you say is sometimes you're seeing this overwhelming, it's defining who they are, or that's what they're putting out there.
I don't know that I agree with how you said that.
Okay.
Although I'm not quite sure what you said. I think what I'm saying is when you said people are putting out there in order to be their authentic selves, I don't believe that is them being an authentic self.
Right.
I think authentic selves have to do with personality and not your experiences. But I think people just put it out there because it makes them... people like attention. People like attention. People like being heard.
Mm-hmm.
And so people put it out there.
Well, and there's a lot of different things that I heard when you said that. I mean, I think people, and we call it being attention needy sometimes, and that's not what I see it as. Sometimes they want to be seen and heard. They want to.
Sometimes it's attention needy.
Sometimes, and hey, we all have those moments, right? Like, there's nothing wrong with that, especially when we can ask for it. But I also think they're trying to find a way to connect with people and wanting people to maybe understand them or get them. I don't know. And I guess my thing is like, why are they going around just saying it, right? So where are they saying it would also be important. Like, where are you talking? Like, if
I don't talk about my traumas. I don't have traumas, really.
We tried to keep you in a little bubble, lots of bubble wrap.
I mean, I've had negative experiences. They're not traumatic.
Well,
they're not trauma.
And you've also grown up sort of understanding bad things happen. We have big feelings, lots of distress, discomfort. It's just a feeling. We get through it. There's good times, not so good times. And then there's traumas, and yes, everybody has different experiences. And so this isn't to minimize any of those, but I think what I also heard you saying was, going back to maybe what I was saying before with the authentic person, I think sometimes people who have experienced traumas, they sometimes aren't as connected with themselves. There's a lot of times maybe the lack of integration of who they are and what their experiences have been. And that's part of the work that they have to do in therapy typically. And so sometimes I don't know that they're really comfortable being themselves. It's almost like too vulnerable.
You're not comfortable being yourself, but you're comfortable with spilling, just dumping all the things that most people wouldn't want out there.
Right. So then you're taught, to me, those are different things, which is one, a filter, but then also this ability to discern what do I say when and to whom, right? It's sort of like, one of my colleagues, I love this. I think, I don't know, I'm pretty certain she had this. It was this, now I'm sort of doubting where I saw this, but essentially like flip-flops. I love flip-flops. You love flip-flops. Wearing flip-flops to the pool. Yes. Flip-flops to the beach. Yes. Do I wear flip-flops? And by flip-flops, I don't mean sandals, dress sandals. I mean literally flip-flops like the $2.99 at Old Navy's. But we don't wear flip-flops to work. We don't wear flip-flops. Well, I mean, unless you're a lifeguard or something. But a professional position. Yeah. I would not choose to wear those kinds of flip-flops to any of my roles where I'm interacting with students or clients or what have you.
I don't interact with people, so I do wear flip-flops.
There you go. But again, that's an ability to discern. It's sort of like, I know that I
wear flip-flops to my practicum.
Okay, good to know.
Yes.
Because you know that.
Yes.
You have the ability to discern. It's sort of like in the library. What kind of voice do we use, right? Usually
a regular one.
A regular one or a low tone, depending. There's different libraries. Okay, in my day, it had to be very low tone.
Yeah, that's like, I don't know. I think people are just,
but
this is
but if you're outside, okay. But I'm talking about. But this is maybe going to what you're talking about is your generation maybe is not discerning as much when to use which behaviors, where, when, and how, sort of thing.
My personal beliefs on the level of volume that's appropriate in a library is not me not being able to discern. I know that you're supposed to be extra quiet in a library. I just think that's a little bit of an overkill.
Okay.
Just a little bit.
So you recognize it. You may not agree with it.
Exactly. I also don't set foot in libraries, so I don't know why that was the thing that you chose.
I was going to say, and I also know you well enough that you're not a loud person in general in public. Mm-hmm. So you're not going to be causing a ruckus.
I'm also not going to a library. I don't know. That's a wrong analogy for me.
All right, but hopefully you get the point. Like there's certain behaviors for certain things, when, where, and how.
And I would respect it if I was in a library. However, I don't agree with it.
Good to know.
It's not that I don't agree. It's just I have other thoughts about it that I feel we should discuss, but not in this setting.
Not in this. Apparently, we're going to have an episode of why Victoria believes she should not have to be quiet in a library if she ever went.
An episode of what Victoria believes should be correct versus what is correct.
All right, we'll just do like Victoria's point of view.
Victoria's hot takes.
I think that sounds like a fabulous episode. We'll plan that one coming up. So going back though, when we think about trauma and who we choose to share it, right? Because when I work with individuals, when I work with survivors, that's something I try to be very clear about. Like who they choose to share their stories with is up to them, and who they choose not to share it with. You should
probably put a little more care into who you're sharing your stories with.
You think that people might want to do that.
I think people should.
You think people should. But so there's two things with this, I think. People just coming out and just sharing things.
I think there's a whole nother part of it that like people, now that mental health is so like widely accepted, I think people are like, well, I shouldn't feel shame, therefore I can tell whoever I want. And like you shouldn't feel shame, but like also who you're telling matters.
Yes. Right? And we don't want shame. And that's a great place to be in, that we don't want people to feel shamed for their experiences. And yet who and when they're saying these things to and what venues, right? We'll just get social media out of the way because I'm a big, like once it's out there, it's out there. And I really try to protect, especially anyone underage, because I've had some who are like, I want to do a recording, or they've wanted to do some things with me. And I really want to protect that because, when you write this and put it out there, when you record this and put this out there,
it's out there.
It's out there. And you've got to think in 1 year, in 5 years, in 10 years, is this something that you're going to want your future partner to see, or your future child to see, and I know that's so far away.
Do I really want my future partner to see that I called almonds stupid a couple months ago?
Well, I didn't just repeated it just now in case he missed it.
Yeah. Anyways, no, I think that's authentically me.
It's authentically
and I would
you.
probably say it to him too, so.
Probably. And even though you don't believe all of that, there's moments that because you certainly worship the ground your dad walks on and thinks he's all that. So anyway.
I question his smarts sometimes, but.
Well, we all do. When we know and love people, we gotta
where did that one come from? And why?
But the thing I think that is important to keep in mind, right, which is when people are just randomly sharing this information, they don't know what space they're in for the other person to be able to hear it. And this is where there's a little bit of a distinction between trauma dumping, which is I'm just putting it out there and it's not in the right container. I don't have consent from the other person that they are able to hear it. Versus probably trauma clumping is we're a group, we get together, we talk about this sort of stuff all the time, which can be helpful in some ways, right? Peer support, hugely helpful in a lot of ways, especially if it is in a way that's sort of conducive to feeling support and feeling heard and validated. But we also have to be careful that it's not going into some sort of ruminating, like that's all they do when that group gets together. Because that can become very unhealthy with those dynamics. And it can lead to a lot of emotional exhaustion. Like they've actually done studies that groups that overshare with these personal types of experiences, they tend to have a high feeling of support, but they simultaneously have high reports of anxiety and depression. Mm-hmm. And so there's a sort of a contagion theory around that too. Like we keep bringing this up, we keep talking about it. And so we're going to stay in these intense feelings instead of having a goal of why am I telling you this? I'm telling you this because I need to feel heard or understood. I'm telling you this because I need some additional support or whatever. Like there's usually some sort of goal if I'm telling somebody this information. And so again, the clumping is, hey, we all agree and we're sharing our stories in a very collective and collaborative way. But then the trauma dumping, like this is something I think I would really want people to pause a little bit more and think about, can this person hear this? Do they have the emotional capacity? Because we've talked about, like you mentioned, like it's more standard now and people are talking about it more in general instead, whereas maybe they would have gone for professional services and shared that.
When people trauma dump to me, I don't listen.
You don't?
I don't. You can see a therapist for that.
Is that what you tell them or do you just...
No, I just gotta go, Then move on with my life.
And move on with your life.
Usually move on to other conversations with other people.
And are they pretty... do they get the sense that you're not listening? They just keep going.
Like I said, I think there's just social awareness thing that's lacking there. And lacking might be a little bit intense. And I'm not saying that these people don't have social awareness. I'm just like, I don't know. I don't know.
Well, and then...
Like, is you wanting to tell your traumas and discuss them, is that clouding your ability to be socially aware?
Right. And then if that's true, then again, how this is impacting their relationships and showing up if they're not even understanding. And so with this, right, if as a therapist, I know I'm in this space to hear and empathize and
I can too when I'm in my therapist role.
When we're in that therapist role.
But if I'm just out and about enjoying my daily life, I don't want to hear it.
Right. And
like I care, but not in that moment.
Not in that moment. But here's another thing that I don't know that a lot of people understand is part of our training, part of our, as a therapist, my ethical responsibility when I agree to take on a client and work professionally is that I'm in the space to do this, right? So I have to make certain that mentally I'm in good space. And granted, we all have different things that we have to do to maintain that on a daily basis. But there have been times in my life that something pretty big was going on. Like I was going through my own traumas, and some big ones for me tended to be about, the birth of the boys, with your dad's, a heart attack, and then really my own car accident. And I did have people reaching out, and I remember a couple like wanting some EMDR therapy for a car accident. And I could not do that in that time because I was still having really strong. I mean, I was in my own services for this, and I'm a trauma expert. Like I know how to do this, but I couldn't get my brain to agree. Like it's just like, why am I crying? Why am I doing this stuff? And so I had to know this about myself and say, no, I cannot, but I know somebody else who is also trained in this. And so this is something we're doing, and we hate saying no. That's an awful feeling when it's like, I'm in a space where I can't be a helper. But that is the ethical and responsible thing to do. But I think when somebody is just randomly out there, just coming and in your friend groups or peer groups or whatever, or even in, social media, and they're just putting it out there, like they don't know how the other person is on the other end and how they're going to be able to hear it and see it and hold it and what they're going to do with it.
Mm-hmm.
And so that's where the trauma dumping comes in, is like, you didn't get consent. You didn't ask them like, hey, I got a lot of stuff happening right now about this topic. Do you have some time to sit down and talk with me? They're just putting it out there, it sounds like.
Yeah.
And so does anybody ever, instead of just like, does anybody like, hold on a second, it sounds like you really need more support than I can give you?
You're a therapist, Angel. You're a therapist. That is a therapist response. That is not your average Joe response.
So it's really just to like, and just not listen really, and be dismissive?
Sometimes I roll my eyes and I walk away, and that one's a little bit meaner, but it's usually someone that I already don't like. And they know I don't like them, and yet they're talking to me.
Well, then there's this whole other thing, right? Which is, and some of us talk about it, like sometimes we just attract. So sometimes I think there's something about who we are that people feel okay just telling us everything. Like random strangers. I cannot tell you the number of times just random strangers just start talking to me about their life history.
People that I barely know are like, yeah, she's a really good listener. She's great to talk to. And I'm like, I don't know you, and I don't even like you that much.
Yeah, but you are a really good listener.
I don't know if most of these people I barely listen to. I just look at them, and I'm like, okay. Here's my thoughts about maybe 1% of what you said, because that's all I listened to. And apparently that 1%.
Okay, then I wonder then about you, and this is maybe getting off topic, but you're not a big talker.
I think I'm just quiet, and I usually just like stare.
Like honestly, the most talking I ever see you do is during this podcast.
Because this is the only social interaction I have. Other than trying to get your attention, and then you want me to carry the conversation. I can't do that.
That's sometimes why you just really want to be entertained. Yeah. So you can just sit and listen.
Yeah.
So yeah. Okay. So this trauma dumping thing, I recognize that some of us can just sort of say, but I think it would even be hard for me.
I've seen people walk up to you in public and start trauma dumping to you, and you're sitting there, you're having a full conversation with them. You're being the little helper you are in your heart, and I'm just like, Angel, tell them to shut up and move on. And I'm saying this very directly and bluntly, but I'm not meaning this in a mean way.
I know. I mean, because like it literally happens
frequently.
And I don't know sometimes like how to not, like I do try to go out, like sometimes I don't know, there was one trip I was on, and there's been a couple times your dad has said, "What is wrong with you?" Because I'm like, I am not working. I'm like, I can't. I'm like, just do not look at anyone. Do not make eye contact.
You're a social butterfly.
I am, but every once in a while,
and people sort of just, they strike up casual conversation, and then they realize there's something about you, and then they just start oversharing and dumping everything, and then you just don't know how to be like, okay, I'm walking away now.
Well, because this goes back to, I really love people and their stories. I love to be able to sit down. Like, to me, it is such an honor to be able to do that. Like, to sit with somebody, and again, those are just sort of moments in time. It's not a professional thing. Like, most of the time, I don't even tell them I never say I'm a therapist in those things. Because I've learned. Then they're going to want more. Well, and it just changes dynamics and stuff. It's like, yeah, we're here at Universal, and I'm just sitting there listening to a life story, and like, it's okay. And then you guys come out because you've done your ride, and I'm like, all right, I've got to go now.
Oh my gosh. See, I like hearing people's stories, but I like hearing it while I'm at work and not while I'm out and about. I have those boundaries.
You do. Which is good. And like I said, sometimes I'm able to get those boundaries, but I've also learned, like, I can't look at anyone. I have to just like keep going. Don't let me loose anywhere.
And I know she will find people to talk to. Or they will find her.
They find me. Very seldom do I ever go up and initiate. Well, the only time I'll initiate something is like, sometimes but I just say like some compliment, like, I love, your necklace or something, but that does not end up in one of these conversations. Anyway, trauma dumping is real. But again, the when and where, the container, but the big thing is, people, before you start sharing your story and sharing the information, you really should get consent from the other. Like, can I share this with you? Like, oh my gosh, I'm about to burst. I've got all this.
No, you cannot.
And then if you said no, you cannot. But Victoria, I don't want
to hear it.
Okay,
go call a therapist.
Well, I don't got a therapist. I don't see them for like a few days. Do you have a list? What's your mom doing? Just joking. Don't send them to me.
She's busy.
She's busy. I'm on a wait list. So, and if you're their friends, then no. Okay. So the trauma dumping is real. And then people just talking about this stuff.
It's just casual.
It's just so casual.
It's so casual. Trauma is just a casual thing.
Sometimes
it's a casual everyday vocab term now.
Yes, well, again, that's a whole nother topic that I could probably spend several hours on, but we'll keep it.
Trauma is just trauma. It's whatever. Let's have a casual conversation. Let me post it on TikTok. This is what happened. This is how I'm feeling about it. And then people chime in with their either support or their non-support or their own stories.
See, and that's another thing.
But it's the attention. You got the attention. You got a response. You got engagement. You got more views. You got an audience now. I don't know.
Do you think this is people wanting the views and audience?
I wonder. Sometimes I wonder. Like, sometimes it just seems like, see, sometimes when it's like a ADHD person, I'm like, oh no, you just got thoughts running through your head and you need to say something. And so you're just yapping. I'm not sure that you know what you're yapping about, but okay. And then other times I'm like, yeah, I'm going to scroll away now.
Okay. Because you're sort of watching that train wreck, sort of thing.
I don't know. Some of the ADHD ones, I'm like, okay, pop off. Tell me 37 stories in the next minute and how they all coordinate and tell me every single character. Some of them are entertaining and like not serious. And I love those ones because they're kind of funny. But yeah.
I'm just sitting here going, is this because you've probably lived with so much of it that you're just, like you feel comfortable in those vibes?
Yeah.
But somebody who just wants
like it's also like not serious trauma. It's just like, let me tell you about the like 37 things that happened this week.
Okay.
That are like crazy and out there, you know?
Like random, life inconveniences, stressors, things that happen.
Just casual things. So it's not like intense trauma, but they might throw out the word.
Yeah. Okay, so the other part to this, and you sort of also alluded to this, but again, this is what sort of threw me off when I was like, okay, trauma dumping, like you guys are saying way too much, probably with social media and the transparency, like all of this. But then y'all told me that like trauma trumping is a thing. Like,
we add to it, Yeah. You're telling me your traumatic story. Let me tell you one back. They might align, they might not.
It's almost like, hold my beer, I got another one, or something.
But me and Coach, I got the next round.
It's like, oh, this really, really bad thing happened to me, and all of this. I was like, hold up, you think that's bad?
Let me tell you my story.
And you guys are saying that this is actually happening.
This happens.
Oh my gosh! Like how?
Sometimes it's just a casual conversation, like you're just building off each other, chatting, yapping.
Like so, sometimes it feels collaborative and like I get you. Like this, like we're just.
Other times it's like okay, so your trauma is more traumatic than mine, but okay.
So a lot of times you're just like trading war stories, and it's like this and that, and it like the camaraderie is there. But then other times it's like. Well, mine is worse than yours.
Depends on who you're with. And I think that's another reason why you should be careful about who you're sharing your story with.
Because do you think it feels competitive?
I don't know.
You don't know because you don't share. You're not one-upping anyone.
I wouldn't say that I have any traumas. So I don't know. I'm not one-upping people.
You're not one-upping? Because you're a very private person. You would not share your stories like that.
I don't think so.
You don't even share big stuff, exciting stuff sometimes. Like sometimes you do. I don't know.
Do I have big things going on?
I don't know. I think you're such an even keel sort of. Like for me, it's good. It's very grounding for me.
What do you mean?
Like, because I'm easily like, I get happy and excited about a lot of things.
I think I'm more grounded about it because you don't.
You do. I know. And then
you don't get excited about things. You're like, oh, cool.
Really?
Yes.
Oh.
I don't think you're as enthusiastic as you think you are.
Maybe not. I feel it on the inside sometimes. But I think, years of training, like you got to sort of like.
Suppress it.
I don't know about suppressing it. I think about managing it. It's a lot about managing energy is what we have to do. And certainly managing our affect. Mm-hmm. A lot of times it's me like making faces.
I'm not a sharer, not an oversharer.
No.
I don't have any traumatic stories to share, and if I did, probably wouldn't do it.
No. And if you did have some, you probably wouldn't even say you had some.
Probably not. Honestly, I would probably, I don't know. There would probably be a yap sesh with Lauren, but...
Yeah.
It wouldn't be like deep and into it. It'd be like, let me tell you what just happened.
Yeah.
And then we'd move on.
Yeah. Yeah.
More like a catch up yap session, not like, let me trauma dump to you right now.
Because I do think things are so heavy for people. Like life in general.
Life is heavy. The world right now is heavy. Why? And apparently we're trauma dumping, which is also heavy.
Yeah, and
I don't think you know what everyone else has going on in their life, so why are you dumping your traumas onto them when they might be dealing with their own things?
That is my big concern, honestly, and especially when we're, dealing with the severe depression and the consequences from that for a lot of people that and especially if you have what we call internalizing friends, right? With internalizing, we're talking about anxiety and depression specifically. And so if I'm sharing and trauma dumping with one of my, friends who's an internalizer who I might not know that they have a lot going on in their own world, I have just added significant weight and burden to them and unknowingly. Right. And that can be very overwhelming for the other individual. And so, again, I think that's why the consent and that reciprocal, I talk a lot about reciprocal relationships because those are signs of healthier relationships. With that, I'm sort of chuckling. This is probably out of context. But sometimes we were talking about like friends sort of attract, and talk to us a little bit about things. And every once in a while, an old friend will pop up because they're going through something and they'll start calling and talking. And, I'm like, you need to see a therapist. You need to, I don't need a therapist. I've got you. And it's like, no, you don't. And so I sort of tell my students this, right? Because that is unethical. I am not your therapist. You need to find your own therapist. And by now I'm getting the vibes that they need more support. And them sort of popping up after all these years is really, they need more support. That's beyond me. And my role is to please get some support. And so, this is probably something I usually tell my students. I don't know that I've ever said this out loud to other people, let alone in a recording. But when I realize that I'm in this situation, you know what I start doing? I just start talking about myself. Right? Because, this is me sitting...
Because it shuts it down.
Well, and if this is about a friendship, it's supposed to be reciprocal. Mm-hmm. I am not your therapist. Mm-hmm. I'm not going to be. That is not appropriate. I've referred you. I'm talking to you as a friend, so I will just start putting my stuff out there. And that usually tapers off real quick. And it doesn't mean that I don't want to be there and a support for people when they need that. And I'm happy to do that, but
it's not your place.
It's not my place. And I need to conserve my emotional and mental space for my family, my clients, my students. I'm already doing a lot of that. So when I engage in friendships and relationships, it's because I hope I am bringing some joy and light and holding dark spaces for them when they need it as a friend, because I know they would be there for me in a heartbeat. And so to me, those are the relationships that I want to engage in with that. So, but the trauma dumping, sort of going back to, or the trauma trumping, holy cow, that's a whole different level of just sort of a wowzer. Talk about typically unhealthy, right? If you're talking about this collective sharing, yap sessions type of thing, to me, that goes back to sort of what we were talking about, with the trauma clumping sort of thing. Yeah, we're in it together. We're joining, we're talking about these things, but the trumping, and I don't think it's malicious at all.
But I think it's all about perception.
It can be about perception. The person may be saying this in a way that says, oh yeah, I get you.
But you might be taking it as, oh, okay, so your trauma is more important.
Yeah, because I would shut it down. And I think anytime you're sort of one-upping, and you mentioned like ADHD, I do think this is a very common, like sort of like for somebody with those types of impulses and attention. And this is why sometimes individuals with neurodivergence have difficulty in relationships, because they're thinking they're jumping in and they're joining and like, I'm with you sort of thing. And the other person is like, dude, you couldn't even hear me and sit with this and let it be about me for once sort of thing. And it feels a bit...
I don't know. If you're trauma dumping, then, someone might just trauma trump you.
So you're saying enter at your own risk.
Enter at your own risk. You did not... no one was prepared to have that conversation. And therefore, the result of that conversation is up to the people in the conversation.
So you're like,
if you want someone to validate or hear you, that's what therapists are for.
Right.
That's not what your friends are for.
Well, you can have a good friend,
but it's not their responsibility. And if they want to yap about their traumas because you're yapping about yours, looks like they get to.
Looks like they get to.
They get to.
So you're all
unless
good
there's a mutual understanding that you're going to talk about something heavy and they're there to listen.
But that wouldn't be the dumping, right? Because you got their consent.
I don't like the word consent.
I know it is. There is a lot of overuse.
And I think it's been overused in this episode.
Well, they know what they're getting into.
Yes,
they're like, yeah, I'm here for you. I totally get you're about to dump on me, and I gotcha.
And I would do that for all about 2 people, maybe 3. I couldn't name them, but...
Oh, you do. You're such a softie. Okay, you've got this exterior. You're just a big teddy bear on the inside.
Do not ever call me a teddy bear. I would let you do it. I would let one of my friends, Lauren, do it. I don't know about who else I would let do that. I don't want to hear it. I got my own things going on. They're not big problems, but I got my own things going on. And I don't want your problems. Schedule an appointment. And if it's with me, then we're probably not friends enough for you to be talking to me like this.
Right. You want to count that as a direct hour.
Yes.
Go make an appointment at your site.
And if you can make an appointment with me, then clearly we are not close enough for you to be talking about your traumas with me out in the open.
And so you like to keep that clear distinction with your friends.
What do you mean?
I just meant you're really good at no, I'm not listening.
For the average Joe, yeah. I don't know.
Anyways. No, I really admire that. Right? But I think this episode we were talking about sort of the Gen X and Gen Z,
No, that was last episode.
That was the last episode. Starts to fade. That I do really like to see the better balance that I think Gen Z is showing with some things. You know? And I don't know, maybe it's also an age and identity thing too, because for someone like me, I don't know how not to be this. Yes, I can set some clear boundaries, especially with friendships and those types of things. But I also it's almost like every part of who I am.
A therapist. Angel is a therapist. Angel is not much of Angel outside of therapist.
Now, see, then that sounds like I need a different...
You need more... Name a hobby. Name a hobby.
I love to read, boat, mostly water sports.
Do you play water sports?
Well, I meant on the boat. I like to sit and read on the boat. I like to watch my kids tube.
Name a winter hobby other than reading.
Other than reading?
Because what I'm hearing is you therapy and then you read.
Oh, I like to prep classes. I like to plan. I like to organize.
So you work and you work And sometimes you
I
read.
do enjoy it. I feel like
so you
getting to
are
have
your
an
job.
impact. Oh, this
Your
sounds
job
like a
is
therapy
your-
session, y'all.
Sounds like it's doctor therapy, mom. Except the daughter, the doctor therapy daughter.
Yes, but well, and I've thought like I have had some hobbies in the past. You know, like I enjoyed scrapbooking, but I probably post. I'm going to say post kid, not that I'm post kids, but since I'm not like running to different activities and doing different things like that, I have thought that I need to gain some additional or go back to some of the things that I really enjoyed doing or discover others.
I think for your generation, it was work and it was family, and that's all you had.
No, because
not all you had, but like that. Those were the main focuses.
Those were a lot of the primary work ethics. But I just like doing things.
I like doing things too, but they usually involve spending money.
Well, I do enjoy vacations.
I like art. I like vacations. I like quality time with me, myself, and I.
Yeah.
I like working out. I have lots of hobbies.
I mean, I do enjoy working out, walking, and that I can spend more time with. I've been getting that. I really enjoyed scrapbooking before, before you were born.
I don't have a scrapbook, guys.
She doesn't.
The
brothers do. But they sort of stopped. Even theirs stopped when she was born. I didn't have enough hands, and that's okay. I love baking and baking. So there's some things with
Except we don't do sugar, so then
we don't do sugar right now. So that takes a lot of those out. So
anyways,
going back, I don't know how we got into my hobbies.
I have better boundaries because I enjoy time with me, myself, and I like bed rotting, and I like hanging out with my friends.
See, and I don't like bed rotting. I don't care for television that much.
I don't watch much. I will read. Not, but
I will read, more than like television and stuff. But going back, I don't know how we got onto this. But I think it's about boundaries.
Has better boundaries.
Maybe, yeah.
Except we don't.
Right.
Because that's literally what we're talking about with trauma dumping. You're violating so many boundaries there.
Yeah. So maybe it's just a different way. Like we do not express as much of maybe our internal states.
Neither do I.
But when they're brought to us, we attend to them. Whereas maybe this is some of the issue is they're everywhere for you all because this is what I'm reading for your generation too. Like you all never get a break from any of it. It's like it's always coming at you, whether it's real or through social media or what, but there's never a time to re-regulate yourself.
Maybe that's why I like bed rotting.
I bet it is because we never had to do that, but I can even tell sometimes when I am working longer hours or I'm scrolling the minute, when I have 10 minutes in between or 5 minutes. And when I don't, like I can get overwhelmed and I have to do more mindfulness or usually by Thursday, I'm finding that, because I have several classes on Thursdays that I need to take a little bit of a break because when I don't, I'm not as maybe grounded. I say a lot of things as the night goes on that, when students ask me questions, I say things and
usually, I don't know.
Well, and sometimes it's more
like, wait, let me figure that one out for you.
I'm like, I'll go figure it out. Well, but sometimes it's even, they'll ask me something and my response, I'm like, oh, I'm probably going to get in trouble for this one. But, I might be a little bit, in my opinion, more authentic in my response, but it may not be filtered well enough. Because I'm telling you, like I said it because you asked my opinion, which I don't often, I'm usually very clear, like this is my point of view and there's several points of view in regards to this. But, this is going to be so important when you think about the trauma and being able to navigate a lot of those kinds of questions or stories. You guys are getting them from all over. I mean, it's everywhere. Like even and depending probably what you're seeing in your social media, if you with the algorithms and stuff, you might be getting a lot more than that. Versus like, I really dislike Criminal Minds so that I can just sort of sit and it's oddly relaxing for me. But I know I'm not the only one, you know? But it's a story and and I usually know that they're going to catch the person. So I don't know. I do think it's a lot coming at you all.
There's a really weird headache going on. I think it's a brain tumor.
Oh dear.
It's like a headache that it's like going down through here, straight through to my eye, like in a diag.
Oh,
yeah.
Oh dear. Like, our listeners, you guys, if this is probably way too late to be of any help to her, but sure, let her know. We'll try to update you. Well, I guess if it's posted, then you'll know she's made it.
Yeah.
But I'll keep an eye on her, I promise.
No, she won't.
Yes, I will. You're going to sit down in the living room.
Anyways, what were you saying?
I'm going to keep my eye on you, girl. I was saying I like Criminal Minds, and then you jumped to Grey's Anatomy. Yes. And you have a tumor. I know how your mind went.
It was just weird that it happened right then.
And you were thinking Grey's, weren't you? I bet you were like,
pardon me, I think it was in there.
Y'all, this is how our minds work. Yeah, it's been a while since I've watched Criminal Minds. Ooh, or Grey's Anatomy. Oh, wait, I might be having a tumor right now.
I didn't start thinking Grey's Anatomy until after the pain.
Oh, till after the pain.
Yeah.
Mm-hmm. I wonder if this is like sudden onset after having some sugar when you haven't had it in a long time. We took a few sips of a drink, non-alcohol. It was a Lotus drink. So
it's Valentine's Day when we're filming this, okay? I needed a little sweet drink to feel festive.
A little festive.
Yeah. Anyways.
So,
where were we?
Where were we? I think we were talking
boundaries.
They're
there, but they're not there.
Right? So even when we think, yeah, we've got good boundaries, like we realize, like, no, part of the issue of me having to have good boundaries is because there's not boundaries over here. Yeah. Or there's so many boundaries. Maybe that's a
really good explanation about Gen Z.
Yes. And this emergence of boundaries. Yes. Whereas I'm sitting here going,
because everyone's like, oh, Gen Z just doesn't want to work. They set so many boundaries of like when they went off, how much they're going to work. Well, we ain't got boundaries other places, so
yeah,
protect your peace somehow, I guess.
Well, because putting the phone down would be too much.
My entire job is social media, Angel. Get off me.
But you don't have to have. Okay, I just share?
Okay, no. How many times do I come on here and I'm like, okay, let me tell you about a TikTok I saw.
It's totally helpful. Do you want to, since we're totally off topic, let's stay off topic. You want to the Snapchat I sent yesterday?
I'll put it on the screen. It was me sitting on the couch on my phone with 3 laptops open. I was working. I was actively working.
Yeah, I know. It takes this many devices.
Yes.
And this many things to happen and stay up on things. So I can see what you're saying with boundaries. But that's interesting. I'd never thought about it, like, as far as, like, from Gen X. Like, I don't think it's that we don't talk about a lot.
But there's that boundary.
Like, we would not share a lot of our stuff. Your very rarely
onto other people.
Mm-mm. I wouldn't even, probably even some of my closest friends. I don't know how much of it is me personally, going back to, we've talked about, like, what are my personality characteristics? Like, we each have individuals. But when my world's falling apart, I cannot reach out to other people. Like, I just need, like, I go to my internal survival.
And then we can discuss it.
Yes. When I come out of it, I will reach out. I will reconnect. I will do my own work, all of that stuff. But it's like this innate, like, I just have to stay within myself because I cannot handle all the input and the thinking and stuff. And
and don't make me put it into words.
Well, and okay, so that's another big thing that a lot of times people do not understand about trauma, because I'll get some people like, Angel, such and such happened. I gave them your card, and these are really big traumas, like life altering types of experiences in people's lives that somebody said they've referred to me. And I'm like, that's okay. But just know, oftentimes after a trauma, especially that life changing, like you don't have words for it. It's like you've just been sideswiped and you're just still twirling and you don't know where you're landing. And so sometimes there's no words. And, so usually I'm like, watch for the sleep. That's the first thing I'm assessing for, because if they're not sleeping well, then oftentimes that can make, we don't know then, is that a trauma symptom or is that a lack of sleep symptom? So we want to make certain sleep is regulated, trying to get as much movement and nutrition as possible to keep that. The whole goal after a trauma is to keep the body regulated in a way that we're not hijacking the entire central nervous system. So that's the biggest thing before people are ever ready to talk about anything.
Sometimes it's not even that serious. Like, this is the best way I have to put into perspective for you.
Okay.
Something we were talking about earlier this week.
Mm-hmm.
When I got upset and I went upstairs to my room and I locked the door. First of all, my dad broke into the room. He learned how to pick a lock on the spot. Anyways, she was like
he didn't bust a door down.
No, he got a credit card out. He figured out how to get through there. He was trying to use tweezers at first. It was entertaining for sure. Not what I needed in the moment, but thanks. Anyway, she was like, well, I didn't think you wanted to talk to me. You're right. I didn't want to talk. Just let me think. And then later that evening, I came down and I wanted to talk.
Okay, but you wanted to talk.
I wanted
you just stood there telling me you didn't want to talk.
No, I was not telling you I didn't want to talk. I wanted you to give it any amount of attention. You're just like, hey.
Okay, to be fair, this was midnight. I was
Whose
tired.
fault was that? She went to bed when I came down. I came down to talk earlier and she was in bed.
I did try to go to bed early. I was so tired. But then your dad also chose to come to bed.
And then let's talk about trauma trumping. Because I'm sitting there crying my little heart out talking about my problems. And then she jumps in with her problems.
Reciprocal relationships. I don't know. I was trying, but I have always said after 8 p.m., my mama skills are, I'm not, like, you want to get up and have a conversation with me at 6, 7 a.m., I'm your gal. Like I can do therapy then. Nothing good happens.
I guess we're just going to end it here. We've been so far off topic. Hopefully you got something good out of that. What are your takeaways?
My takeaways. I think talking through some of these things with you helped me gain some different insights as to what your same age peers might be experiencing, and maybe, those younger, so those teens and early young adults, with the overwhelm, how they're seeing trauma and why it's just so just go ahead and talk about it because there's no shame. But yet the fact that you guys can never escape it sometimes, and what that means, because I'm worried about that. And then I'm also, and I don't know that I'd ever really spent a lot of time thinking about when you all are just sharing your stories with people, the people that are hearing them may not be in a place to hear them, and what that means for them to be put in that position. So that's made me think of some things a little differently. What about you? What are your takeaways from all this?
I thought not a lot at all, actually.
Really?
I think there's a lot said, and I think it was all very valuable.
Mm-hmm.
I definitely did not think that I'd be talking about trauma dumping and trumping for this long. Never in my life did I think this was going to be a conversation that we were going to have, but okay.
But nothing that stood out to you that you're walking away with?
I think there's a lot of interesting things said, but nothing major takeaways.
Yeah.
I don't know.
I mean, I think this is something for me.
I think all of this was a major takeaway. And so if you didn't watch the whole thing, well, then you're not hearing me say this right now. But anyways.
Or seeing that massive eye roll that you just gave. I think this is one of those too. And for those our listeners who did go all the way through this, I would love to hear more comments, because I think this is something that I'm going to continue to be thinking about and evolving my thoughts based on the more I see and hear, because trauma is what I do. And so, again, the way
The different perspectives.
these are different perspectives. And I do think that some things have shifted in how things are. Because like I said, this whole episode came about because a client shared, like, hey, you should talk about like this, the just always talking about trauma and then having to trump each other. And I was like, what do you mean? This is a thing. We gotta one up people on their traumas.
Always.
Oh, dear. We have so much work to do, right? And instead of evolving and moving towards mental wellness,
wrap it up, honey.
You guys are perpetuating the need for mental health. Anyways,
it's keeping you employed.
Oh, yes, but I work every day because I would love to work myself out of a job. I want everybody mentally well. It would be a fabulous place to be. I trust my skills. I will find something else to do.
All right. Bye-bye.
Bye-bye.